طب الازمه نشوف فيها ايه من برونكيولايتس شفنا الازمه هتلاقي حاجه اسمها ايه ساين او ايه لاين كده اسمها ايه لاين دي بريدكتير هايبرنفليشن يعني انه داخل على الانفكشن مثلا هو ايه لاين بس يعني احنا لو وعندك بقى البرونكيتس اهو Cystic Fibrosis
Bismillah ar-Rahman ar-Rahim. It's our great pleasure to start this session in this amazing afternoon, inshallah. A very good scientific day. Thank you very much, Professor Iman Fouda, Head of Pulmonology Unit in Shams University, for organizing this highly distinguished scientific day. My all thanks also to Professor Sarwat Draz for the co-help in this day. It's my pleasure to share Professor Sally Rafat, Professor Dina Tawfiq, Professor Huda Mitwali, and Professor Mervad Gamal. It's our pleasure to introduce the first speaker in this session, Professor Amel Elfaramawy, Professor of Pediatric Hepatology in Shams University. Yes. She is going to enjoy us with her talk, Hepatic Involvement in Cystic Fibrosis.
Assalamu alaikum wa rahmatullah. Thank you so much, dear Professor, for your kind introduction. Dear professors, dear colleagues, it's a pleasure to be with you in this outstanding scientific meeting. And I'd like to thank Dr. Sarwat, Dr. Iman, Dr. Ihab, Dr. Ramay for the invitation and all the effort in the field of cystic fibrosis. My talk is about cystic fibrosis related liver disease. I will not go into details of cystic fibrosis. You have already heard a lot. I will just remind you that the genetic mutation in cystic fibrosis encrypts a protein that is essential in the transport of chloride through chloride channels. These chloride channels are not only expressed in the epithelial lining of the airways, but also in the pancreas, bile ducts, and the intestine, as well as the reproductive system. That's why CF is a multi-system disease. I'm going to focus in this presentation on hepatobiliary manifestations of cystic fibrosis. Actually, with improvements in treatment of the pulmonary complications of CF and increased lifespan of patients, hepatobiliary complications are increasingly recognized. It is estimated between 20 to 40% of all CF patients to have associated liver disease. approximately 5 to 10% of CF patients develop multilobular cirrhosis in the first decade of life, and this is considered to be very early. CF-related liver disease is now the third most common cause of mortality after cardiopulmonary and transplant-related causes, responsible for approximately 2.5% of all deaths. Moreover, established liver cirrhosis could be a barrier to lung transplantation if indicated. Thus, actually, a better understanding of CF liver disease and new strategies to diagnose and prevent progressive liver damage are mandatory. There are many factors contributing into the pathophysiology of liver disease in CF. طبعا زي ما سمعتوا طول اليوم ان في defective CF transmembrane regulator protein. This will lead to defect in the chloride transport. This will lead to increased bile viscosity and decreased bile flow. Virtually, this will lead to bile precipitation and stones in the biliary system with focal biliary obstruction. The abnormal bile formation in CF patients is toxic bile, so it will lead to a state of inflammation with inflammatory cytokines that will initiate periportal inflammation and fibrosis that will lead to focal biliary cirrhosis and multilobular biliary cirrhosis with portal hypertension and all the consequences of liver cirrhosis. Other important factors in the etiology of CF liver disease is the changes in the gut microbiota along with increased epithelial permeability, allowing for the bacterial products to reach up to the liver with, again, a state of inflammation and inflammatory cytokines and fibrosis. Another important contributing factor is the presence of malnutrition. زي ما سمعتوا من دكتور مي بيكون في deficiency of essential fatty acids وكارنيتين وكولين. These essential fatty acids are actually a negative regulator of hepatic lipogenesis. So when they are deficient, they will add to hepatic steatosis. برضو فكرة إنه ال patients with cystic fibrosis are always in a state of chronic inflammation. This will lead to oxidative stress with inflammatory cytokines that will lead to inhibition of the peroxisomes and the mitochondria, the organelles responsible for the fatty acid oxidation, and this is an adding factor to the formation of liver steatosis, which is a common problem in CF patients. The last factor in cystic fibrosis liver disease is that patients with cystic fibrosis are at higher risk of hepatotoxicity due to drug-induced liver injury due to prolonged courses of antifungals and antibiotics and medications that may be hepatotoxic. Cystic fibrosis related liver disease is a heterogeneous group of conditions with a wide spectrum of findings that we may find in the patients. Asymptomatic elevation of liver enzymes with hepatic steatosis are considered the most common findings in cystic fibrosis patients. Focal biliary cirrhosis is more common in adults. Multilobular cirrhosis is more common in children and it occurs early. Non-cirrhotic portal hypertension is an emerging finding. Neonatal cholestasis is not very common. It is reported to be in less than 1% of patients. كوليليثياسيس كوليسيستايتس مايكرو جول بلادر زي ما شفنا مع دكتور ممدوح في بايل داكت انجري ستريكتشرز سكليروزين كولانجايتس بتبقى اكتر في الادلتس. الحقيقه ان السبيكترم بتاع الهيباتوبيلياري ديزيز ان سي اف بيشنتس ار يوجوالي اسيمتوماتيك وده بيخلي الدايجنوزس is challenging لانه ما فيش symptoms early عند البيشنت except late لما يدخل في liver cirrhosis والcomplications of liver cirrhosis انما early they are usually asymptomatic بالاضافه لانه there is no specific diagnostic tool to diagnose CF-related liver disease. Debray et al. In 2011 proposed a criteria for the diagnosis of CF liver disease, requiring identification of at least 2 of the following: evidence of hepatomegaly or splenomegaly, liver enzymes elevation above the normal limit on 3 consecutive occasions over 12 months, ultrasonic evidence of liver involvement, whether the size or echogenicity, portal hypertension, biliary involvement. This is currently the most commonly used criteria for the detection of CF liver disease. As I told you, CF liver disease is usually asymptomatic, and when manifestations occur, it will be very late manifestations of liver cirrhosis. So we have to do screening for CF liver disease. In everyday clinical practice, we have to do regular clinical evaluation of liver enzymes activity, measurement of the synthetic function of the liver, and ultrasonography. In some centers, to assess advancement of the disease, upper GI endoscopy is performed. This is actually when the patient is found to have a liver disease, as well as histological examination of liver biopsy. Liver biopsy may show areas of bile stasis with ductular proliferation, as in slide A. In slide B, this is focal biliary cirrhosis. In C, this is a massive marked steatosis of the liver. And in D, this is a regenerative nodular hyperplasia. Recently, new data accumulated on the advantage of the use of FibroScan as a non-invasive method to stage a liver biopsy, but not still in the screening, diagnostic screening criteria. The treatment of CF liver disease, زي ما سمعتوا برضو في كل التوكس إن هو multidisciplinary team for the care of patients with CF in a dedicated centers or units. This is the standard care for the patients. وزي ما سمعنا من دكتور مي انه في كل البيشنتس اللي عندهم cystic fibrosis including those اللي عندهم cystic fibrosis liver disease لازم يكون well balanced diet. دي حاجه very very crucial. والويل بالانسد دايت ده برضو زي ما دكتور مي قالت لكم ان الفات والفات soluble vitamins الحقيقه ان هي necessary، وان اللي انا عايزه اكد عليه انه مش علشان البيشنت عنده liver disease احنا we should restrict البروتين. This is very wrong beliefs. البروتين restriction مش بيتعمل unless اذا كان البيشنت عنده decompensated liver cirrhosis و hepatic encephalopathy. This should be very clear. Other modes of treatment is the use of orthodeoxycholic acid. Orthodeoxycholic acid is a secondary dihydroxylated bile acids. It has been used for years for the treatment of CF liver disease. It has a cytoprotective effect on cell membranes exposed to the toxic bile. It stimulates other chloride channels that are non-CFTR, that's the calcium activated chloride channels, stimulates bile acid secretion, thus stimulates the bile flow, and it has immune regulatory properties. However, although some studies have shown significant clinical effect of orthodeoxycholic acid, إنما الدروباك إنها طبعا ملهاش أي effect على natural history of the disease، وإن هي it didn't show أي impact on patient survival. الجين modifiers او الكوركتورز او الموديوليتورز دي اللي هي newer medications approved بال FDA وليها promising results على البالمونري symptoms، ولكن الحقيقه ان هي الافكت بتاعها او الافيكاسي بتاعتها في السيستيك فايبروزس ليفر ديزيز is not well studied، فمحتاجين studies. الانديكيتورز اوف ليفر ترانسبلانتيشن يبقى كالمعتاد البروجريسيف ليفر ديسفانكشن او الديفلوبمنت اوف اسايتس intractable hemorrhage hepatopulmonary او portopulmonary. These are indicators of liver transplantation. This is a study in short that was conducted under my supervision in collaboration with the pulmonology unit to assess the prevalence and predictors of liver involvement among children with cystic fibrosis, in which 50 patients were included. They were all fulfilling the criteria of diagnosis of cystic fibrosis, and they were 46% males and 54% females. They were subjected to abdominal ultrasound and clinical examination and assessment of the liver profile. Cystic fibrosis liver disease was found in 38% of our patients, and they were all asymptomatic. They were detected by biochemical through elevated liver enzymes, ultrasound findings, and a clinical examination to find the accidental discovery of hepatomegaly, or combined any of these findings together. A comparison between the group of cystic fibrosis with the liver disease and those without liver disease showed that those with liver disease were significantly males. They were significantly older, with early onset of the disease, longer duration compared to the group with no liver disease, and also a higher mortality rate was reported in the CF liver disease group. The most common mutation encountered in the group with CF liver disease, again, is the delta related to class 2 genetic mutation, and it was significantly delta F508. The genetic mutation related to the other group with no liver disease was mainly in the class 5 genetic mutation. The weight and height percentiles of those children in the group of CF with liver disease were significantly lower than the group with no liver disease. The majority of them were below the 3rd percentiles. The assessment of the severity of pulmonary involvement was markedly severe symptoms in the group with CF liver disease. History of NICU admission for meconium ileus was reported significantly in the group with CF liver disease. Diabetes was reported in the CF liver disease group significantly. The compliance on the pancreatic enzyme was, patients were non-compliant in the group with CF with liver disease. Actually, also the oxycholic acid was not used by our patients just in a small group, so we couldn't assess the effect of orthodeoxycholic acid. So the conclusion was that انا بس برضو حابه اقول لكم حاجه هنا، انه انا الدسكشن في السيشن اللي فاتت عن الليفل بتاع السويت كلورايد تيست، يعني احنا لقينا انه اللي عندهم سيستيك فايبروزس ريليتد ليفر ديزيز السويت كلورايد تيست الارقام بتاعته كانت اعلى من الجروب الثاني وكانت سيجنيفيكانت، بس انا الحقيقه ما حطيتهاش لان انا اي ثوت انها اتس نوت امبورتنت، بس في الدسكشن طلع ان هي فعلا امبورتنت، فايت از ريبورتد في الاستادي دي برضو. معلش دقيقة واحدة، أنا فاضل لي ثانية. It was concluded إنه liver disease is common in children with cystic fibrosis. They are usually asymptomatic, so we should look for liver affection in those patients with regular screening. الريسك فاكتورز في الاستادي دي كانت الميل جندر، الايرلي ديزيز اونست، الميكونيوم الياس في النيونيتس، الفولترنج اوف جروث، السيفير بالمونري سيمبتومز، النون كومبلاينس على البانكرياتيك انزيمز، ريبليسمنت ثيرابي، وكلاس 2 mutations. Future challenges that we have to solve are determination of the effect of gene modifiers as a novel therapeutic strategy on cystic fibrosis liver disease. More specific non-invasive diagnostic tools الحقيقة are needed for surveillance of patients with possible liver disease. Implementation تاني أكيد سمعتوه في كل التوكس، implementation of neonatal screening for early detection, early intervention، ده هيؤدي إلى better outcomes أكيد. Thank you so much for listening.
بنشكر الأستاذة الدكتورة أمل على المحاضرة الرائعة الجميلة دي، خاصة إن هي شي بوست لايت على أهمية إن إحنا نعمل فولو أب لحالات البيلياري سيستم والليبر، عشان ما يبقاش ده كمان كوز اوف ذس الأطفال اللي عندهم سيستيك فايبروزس. دلوقتي في